Après-midi, tout le monde et bienvenue à cette mise à jour sur le COVID-19 au
Welcome to today's update on COVID-19.
update on COVID-19 in New Brunswick. Speaking on behalf of the province today in the following order. Dr. Jennifer Russell, the province's Chief Medical Officer of Health. The Honorable Dorothy Shepherd, Minister of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant.
Today's spokesperson in the following order are Dr. Jennifer Russell, the Honorable Dorothy Shepherd, Minister of Health, and the Honorable Blaine Higgs, New Brunswick's Premier.
Good afternoon, bon après-midi à toutes et à tous. Le Nouveau-Brunswick est entré dans une nouvelle phase de la pandémie de COVID-19.
New Brunswick has entered a new phase of the COVID-19 pandemic. Through the Dr. Charles Dumas Hospital Laboratory in Moncton, we have confirmed the first cases of the Omicron variant in our province. 2 cases in Zone 7, which is the Miramichi region, and 1 case in Zone 1, which is Moncton and Southeast New Brunswick, are confirmed to be from this new and more transmissible variant of the COVID-19 virus. There are 4 other cases in these zones that are directly linked to the first 3 cases. They are therefore presumed to be Omicron cases. We fully expect to see more. These new cases are linked to the recent outbreak at St. Francis Xavier University in Antigonish, Nova Scotia.
Entered a new phase of the COVID-19 pandemic. Through the Dr. George Dumas Hospital Laboratory in Moncton, we have confirmed the first case of the Omicron variant in our province. 2 cases in Zone 7, which is the Miramichi region, and 1 case in Zone 1, which is Moncton and Southwest New Brunswick, are confirmed to be from this new and more transmissible variant of the COVID-19 virus. There are 4 other cases in these zones that are directly linked to the first 3 cases. They are therefore presumed to be Omicron cases. We fully expect to see more. These new cases are linked to the recent outbreak at St. Francis Xavier University in Antigonish, Nova Scotia. We are working closely with our Nova Scotia colleagues to slow the further spread of this variant through our region. The arrival of the Omicron variant is not unexpected. We have seen a sharp increase in cases in Ontario and Quebec over the past week, with many new cases caused by this variant. Il s'agit d'une tendance à
This is concerning because there are traits of Omicron we do not yet know. Further precautions must be taken. We must and we can protect our people and our healthcare system.
There are traits of Omicron we do not know yet. Further precautions must be taken. We must and we can protect our people and our healthcare system. Thanks to everyone who has become vaccinated and are following public health guidance, we are much better positioned to deal with this variant than other versions of this virus. The introduction of the Omicron variant will require changes in our approach to managing COVID-19, which the Premier will speak to in a few minutes. I want to tell you what we know and what we don't know about the Omicron variant. Scientists around the world and here in Canada are investigating this virus and discovering new information every day. What we do know is that this version of COVID-19 is much more transmissible than previous versions. Les données montrent
Evidence shows that this variant is at least 30% more transmissible than the Delta version, which is now the dominant strain in New Brunswick.
This variant is at least 30% more transmissible than the Delta version, which is now the dominant strain in New Brunswick. In South Africa, where this variant was first detected, there has been a sharper rise in cases than in earlier waves of the pandemic. This is consistent with what we are beginning to see here in Canada. What we don't fully understand is the severity of the Omicron virus. It is not clear yet if it will lead to stronger or milder cases of infection. Cependant, si l'on se
But based on what is happening elsewhere in Canada and around the world, it will soon overtake Delta as the dominant variant of COVID-19. While vaccination continues to provide a level of protection, there is evidence that booster shots are required to maximize their effectiveness against Omicron.
happening elsewhere in Canada and around the world, it will soon overtake Delta as the dominant variant of COVID-19. And while vaccination continues to provide a level of protection, there is evidence that booster shots are required to maximize their effectiveness against Omicron. It appears that those who have had COVID-19 in the past can be reinfected with this variant. We know that a rapid rise in cases of COVID-19, particularly among those with other health issues or who are older and unvaccinated, will result in greater numbers of severe illness that will further strain our healthcare system. With Omicron, it's a numbers game. Cases double approximately every 2 days. The sheer volume of cases we expect to see in Canada is quite large. Based on our knowledge and based on modeling, it may translate into more hospitalizations, and that is why it is more important than ever that New Brunswickers become fully vaccinated as soon as possible. Given the growing number of cases among young children in our province, it is vital that every parent ensures that their children between 5 and 11 years of age get their first dose of COVID-19 vaccine. As mentioned, booster shots provide a further necessary layer of protection. Two doses is good, 3 doses is better. We need to maximize our protection in every way possible. Every New Brunswicker over the age of 50 is now eligible to receive their booster if they received their second shot anytime in June or before, and I encourage every eligible New Brunswicker to do this. I'm grateful that both my parents have received their booster shots. Appointments are available through Regional Health Authority clinics and participating pharmacies. Nous renforcerons nos capacités afin de mettre.
We are building capacity for more clinics as quickly as possible so more New Brunswickers can get their boosters as soon as possible. We are continuing to see elevated numbers of cases in New Brunswick as the fourth wave of this pandemic continues. Today, Public Health has confirmed 100 new cases of COVID-19 in New Brunswick, along with 69 recoveries. There have also been 2 more deaths due to this virus.
More clinics as quickly as possible so more New Brunswickers can get their boosters as soon as possible. We are continuing to see elevated numbers of cases in New Brunswick as the fourth wave of this pandemic continues. Today, Public Health has confirmed 100 new cases of COVID-19 in New Brunswick, along with 69 recoveries. There have also been 2 more deaths due to this virus. There are now 1,048 active cases of COVID-19 in our province. There are now 41 patients currently in hospital, of whom 14 are under intensive care. COVID-19 has been with us for almost 2 years. It is now clear that it will be with us for some time to come. Our goal is to slow the spread of this virus. We need to buy time so we can get boosters into as many people as possible to increase protection for ourselves, our families, our communities, and our healthcare system. I know that we can do this because we've collectively done it before. If we all act responsibly and treat one another with kindness and consideration, I am confident that we can do this again. Knowing that everyone is very, very tired, please look after yourselves and each other. Thank you.
Good afternoon. Bonjour. As Dr. Russell has just informed us, we now have confirmation that the Omnicron variant is present in New Brunswick. This is not a surprising development, as the variant has already been detected in many countries around the world and in several provinces in Canada. However, it is certainly concerning to learn that cases have been found in 2 zones in our province. We know we will need to take additional steps to help slow the spread of the variant and protect all New Brunswickers. This 4th wave of the pandemic has not been easy for our province. We have experienced a surge of cases over the past few months, and we have all had to make adjustments as we have learned to live with COVID-19. While we are still learning more about Omnicron, we already know that over the past 21 months, the COVID-19 virus has consistently managed to find the weakest link. Right now, we need to ensure we do everything in our power to protect our healthcare system and the staff working at our hospitals. We know that our healthcare system is fragile. We are all aware of its challenges and vulnerabilities. Throughout the pandemic, protecting our hospitals has been a key focus. Right now, there are 41 hospitalizations due to COVID-19, with 14 in the ICU. Of those in hospital, 5 are on ventilator. While the current number of hospitalizations is still manageable, we need to be vigilant, so the situation remains under control. If the number of hospitalizations and ICU admissions does rise significantly, it will have a serious impact on all New Brunswickers. Some of our hospitals have already had the experience of being forced to cut back temporarily on some regular services. This is something we want to avoid as much as possible, so people can continue to have appointments and routine surgeries and treatments. Other jurisdictions have experienced a much worse situation in which healthcare professionals have been forced to make heartbreaking decisions about who to care for and who to turn away. This is something we must avoid at all costs in New Brunswick. I realize that our healthcare workers are already feeling a great deal of strain. This 4th wave has been extremely demanding of them. Contact tracers and other public health employees are also experiencing this impact. I want to take a moment to thank all of those dedicated employees for continuing to show up and take care of New Brunswickers, even in the face of incredible hardship. In addition to the measures Premier Higgs will be announcing shortly, we know there are things we can all do to protect ourselves, our healthcare workers, and hospitals. This includes continuing to wear a well-fitted mask indoors and wearing a mask outdoors when physical distancing cannot be maintained. Keep your contacts as low as possible. If you are going out for errands, work, or holiday gatherings, assess your personal risk before leaving and try to keep track of where you are going just in case you need to inform contact tracers. We know that the likelihood of becoming seriously ill from COVID-19 is much lower among the vaccinated. We are still seeing our vaccination numbers rise. As of today, 82.3% of eligible New Brunswickers are fully vaccinated. The vaccine was only made available to children aged 5 to 11 in late November, but 28.1% of that age group has already received their first dose. We also know that booster doses have been shown to be effective in protecting against the Omnicron variant. So far, 9.2% of eligible New Brunswickers have received a booster dose. If you do fall into one of the eligible groups for a booster, including those who are 50 and older, I strongly encourage you to book an appointment for your shot if you have not yet done so. I know the holiday season is right around the corner, and everyone is anxious about being able to spend time with their loved ones. We have all had another hard year, and seeing our family and friends, close friends, is very important, especially around this time of year. We can all still experience the joys of the holidays with our loved ones. We just need you to do it safely, keeping in mind all the lessons we have learned over the course of the pandemic. Please continue to take care of one another. I know it isn't always easy, but when each of us does our part, we are protecting not only ourselves and our loved ones, but also our healthcare system, our community, and our whole province. Thank you. Merci.
Thank you.
Good afternoon. Bonjour. With cases of the Omnicron variant now confirmed in our province, I know that people are concerned, as am I. The holiday season is here, and with more people gathering and socializing, it is vital that we work together to slow the spread of COVID-19 in our province, as we have done before, while still finding a balance of living with COVID. Le variant Omnicron
The Omicron variant will become dominant in our province, and our hospitals will be overwhelmed if we don't take action collectively. And now.
Omnicron poses. Addition of Omnicron, we are putting several interim measures in place to help slow the spread of COVID-19. This is especially important considering the extra activity the holiday season brings. Nous collaborons de près avec.
We are working closely with our colleagues in Nova Scotia who are experiencing the same issues. We want to be as consistent as possible.
Who are not yet vaccinated. So the holiday break for children from kindergarten to grade 6 will begin early. La dernière journée de
The last day of school for these children will be this Friday.
Zone 3, we are seeing the majority of cases in children. Rapid test kits will be sent home today with all children in kindergarten to grade 8. In addition, sports and organized activities for all children under the age of 12 are suspended as of tonight at 11:59 p.m. This includes any upcoming scheduled sporting tournaments. Children under 12 are not fully vaccinated. And as children under 5 are not yet eligible for vaccination, we are taking steps to limit exposures in those age groups. These steps will help us to slow the transmission as we continue with our booster doses and pediatric vaccinations, and will limit the number of children in a cluster when exposures occur. Also, as of tonight at 11:59 p.m., for those 12 and older, sporting competitions and games, including upcoming tournaments, are suspended, but practices and skill drills are permitted if they only involve one team at a time and the organization has an operational plan that includes distancing and sanitization. Beginning this Friday at 11:59 p.m., there will be some additional changes to businesses. Entertainment centers, including movie theaters, professional sporting events, casinos, will be operating at 50% capacity with distancing of 2 meters. Patrons are permitted to dine in at restaurants, but physical distance of 2 meters must be maintained between tables, and proof of vaccination remains required. For businesses and retail spas, salons, and gyms, they must ensure 2 meters of distancing is maintained at all times. Businesses and organizations must take steps to ensure that they do not admit more people than can be safely allowed to maintain 2 meter physical distancing. And inside their business, take steps like signage, directional arrows, and lines to help keep people 2 meters apart. And depending how things change in our province in the coming days and weeks, we may require further restrictions. We know that we're coming into a busy season, and it's really important that we refocus on the efforts that we've become so accustomed to over the past 2 years. We cannot let our guard down now, and in order to avoid further restrictions that could potentially impact our holiday season, we need to stay very focused and just manage ourselves accordingly.
I know this will be difficult for some companies, as this is the busiest time of the year.
We are working with the federal government and will work with you on ways to protect you and to minimize the impact, as we know that this does have an impact on businesses. But as I said earlier, we're trying to minimize that, but we'll follow the events of the next few days to see where we need to go. We know that with this holiday season approaching, many New Brunswickers have made plans to visit friends and family. To balance the need to slow transmission with a desire to see friends and family at this time, 20-person gathering limit is being placed with the familiar Steady 20 theme. Your Steady 20 is 20 consistent people from outside your household that your family interacts with. Votre ménage plus fréquenté.
Your household may have the same 20 contacts. We are talking about 20 contacts per household, not per family member.
To spend time with family and friends over the holidays while slowing the spread of COVID-19. Support contact tracing efforts and buy us some time to get more children protected and roll out booster shots to more people as they have shown significant effectiveness elsewhere in the world against Omnicron. The last 21 months have been filled with challenges, and with the confirmation of the Omnicron variant in our province, we now face a new challenge. Je suis persuadé.
I am confident that we can meet this challenge, as we have done in the past.
Measures are aimed at slowing the spread of COVID-19, but we have worked to find measures that allow us to balance the importance of physical, mental, and financial well-being with reducing transmission. With what we know about Omicron, we cannot stand by and not take action. And should the situation change, we may have to move beyond these interim measures and into level 2 of the winter plan. We take the steps needed when they are needed to ensure our healthcare system does not become overwhelmed. Nous avons vivre.
Yes, we have to live with COVID-19, but always keeping in mind that we must protect vulnerable New Brunswickers, our children, and our healthcare system. Thank you.
Merci beaucoup, Monsieur Premier Ministre, Madame Ministre, et Dr. Russell. Thank you, Premier, Minister, and Dr. Russell. We'll now proceed with questions from members of the media. You have the right to pose your questions in the official language of your choice. Each reporter will have one question and a quick follow-up. Nous allons maintenant procéder aux questions.
We will now move to reporters' questions. You always have the right to ask your questions in the official language of your choice. Every reporter can ask one question and one follow-up question.
Of CTV.
Hi there. I'm wondering if any of the Omicron variant cases are being treated in hospital at this time.
I don't have exact details on what the status of the newly diagnosed cases are, so we'll keep you posted on that.
Ms. Brown, do you have a follow-up?
Yes, I'm also wondering, this sounds like it's not level 2 of the winter plan and it's not level 1 of the winter plan. Would you consider it, I guess, level 1.5, or it doesn't really fit into either category from what I can see?
You are correct, Laura. I guess the triggers that we were watching closely for level 1 and level 2 were based on, what we'd seen for changes. And as you read in the outline, what it triggered was an evaluation by public health of our situation. Now, obviously, our cases have been, although they've been rising, we're maintaining a pretty steady level in the hospitalizations. But the Omicron presence has brought a new element of concern and how that may rapid spread. So what we've done really here is say, okay, well, let's look at the schools, the area of transmission, because 50 or 60% of our cases are involved in the age groups that we're let's say, locking down at this point. We know that this is a situation where large gatherings, so we've got controls on that with the changes in the capacity. And we're trying to maintain an element of what people are enjoying, getting back together with family and friends. And to be very frank, it's having people accept the reality and not turn it into a complete denial. We are relying on everyone to be part of the solution. And Omicron variants in this has created a whole new element of concern. So we're going to try to manage it in increments, but we very well in the next few days could go to a full level 2 or beyond. We were putting in these orders for businesses to take effect as of Friday, but we could be back here on Wednesday talking about a full level 2. So we are bridging right now to a timeline that we set for Friday, But it could get stronger and it could become, further restrictions. But if we can see a really good response from everyone who's, I know, more focused on Christmas and the holiday season than maybe they are on COVID, because they've been vaccinated and they feel like, I've done my part. Well, right now we're focused on boosters and we're focused on everyone getting that third dose and doing that 50 plus, just getting it booked, getting it done. And I'm hopeful that we'll be able to manage this. Hospitalizations remain to be key, and we won't lose sight of our ability to deal with that. So we may have to go further, and we may have to do it quickly, because every day is a new day with COVID, and it's a changing environment, unfortunately. Thank you.
Thank you. On va maintenant procéder à...
We will now move to Mr. Pascal Reichnug with Radio-Canada. Thank you. So my question is for Dr. Russell. So could you please explain to us in French what's going to happen with schools? So is it only for Zone 3? Is it for the whole province? Could you please summarize in French the decisions that were made regarding the closures of schools? So the announcements made for schools, that's for the whole province. So regarding sports, sporting events, and changes involving younger students. And also for the rapid test kits that were given to students so that they can bring back home. That's for the whole province as well. Is that okay? Do you have a follow-up question? Yes, I'm just wondering, what made you decide to close down the schools from kindergarten to 6th grade starting on Friday? So what motivated this decision? Well, we're very aware that with the new Omicron variant, transmission risk is higher. It's much more transmissible than the Delta variant. So to protect those who are unvaccinated, it will give us more time to go ahead with our vaccination program. And with all the new information we're receiving about Omicron, it is very related to all those facts. Thank you.
Hogarth with CHCO TV.
Thank you, Bruce. Premier Higgs, Maine reported a record-breaking day of over 2,100 new cases last week, and that was just 2 weeks after American Thanksgiving, which could be an indication of what's to come after the Christmas holidays. So with Maine's case numbers in mind, coupled with the arrival of Omicron, would you consider extending the Campobello ferry beyond December if things do start to get worse?
Yes, we would. We said all along that until things got back to normal, we would continue the ferry operation. And so we'll be watching that very closely about activity and their ability to move through Maine as they always have pre-COVID. And so, yeah, short answer is we would certainly consider that.
Thank you, Premier. Thank you, Ms. Hogarth. Do you have a follow-up today?
I do. It's for Dr. Russell. Dr. Russell, how long is it projected until Omicron becomes the dominant variant in Canada, and how effective is the vaccine against it?
Hi, Vicki. I spent quite a bit of time on the weekend conferring with my colleagues across the country and Public Health Agency of Canada on those very points. What is clear, based on the preliminary data that we have, is that that third dose is really important in terms of the protection against the Omicron variant compared to the Delta. So that's why we're pushing right now to have as many people getting their third shot as quickly as possible, and trying to get the school-age children vaccinated as well, the kids under 12. And in terms of replacing the Delta as the primary circulating variant of COVID-19, the doubling time is every 2 days roughly. So we do expect to see the replacement of Delta very, very quickly. In places like Ontario, they are predicting that will happen by Christmas.
Thank you both. We'll now go to Natalie Sturgeon with Global TV.
Thanks, Bruce. My question is for Dr. Russell. I know it sort of happened quite quickly, but is there any modeling that you guys have been able to do in terms of how quickly, with the doubling time, how quickly this is going to spread?
Well, as you know, Nova Scotia was making announcements today, again, based on the outbreak that originated from the St. FX celebrations and ceremonies. So based on, again, the origin of those Omicron cases right now, and based on the fact that we know that the doubling time is roughly every 2 days, we do know that people become infected quite quickly within 2.5 days and become symptomatic quite quickly. So at this point in time, again, we do expect that we're going to have second, third, fourth generation transmission in the next 4 to 8 days.
Ms. Sturgeon, do you have a follow-up?
Yeah, my follow-up is for Premier. I'm just wondering how worried you are, given the close proximity to Christmas, about people sort of taking matters into their own hands and continuing to do gatherings regardless of what restrictions may be in place.
I'm very concerned about that. That's why, going to the 20, kind of the steady 20 and to that format, it's consistent with what would probably work for most families. And basically, it hopefully it's realistic and we can manage that collectively. But unless the public decide to be part of this, we will not be successful. The key factors here in relation to certainly the following the normal public health rules and what we're used to in distancing and masking and hand washing, it's basically the boosters. And it's getting those booster shots as quickly as possible. We are in a race here like we were before in terms of people getting vaccinated when they first came along, the vaccinations. Well, now we're in one to get the third dose out and have people ensure that they continue to be protected. So along with just doing what makes sense, and this, it is just sense, common sense in many ways. I know it's frustrating. I am very concerned about the Christmas period and people gathering in larger numbers than they should. But I just encourage everyone to just continue to stay focused. Let's not let this turn into what we've seen in hospitals become overrun. I've been so impressed with our hospitalization levels and the ability for us to manage it within our own system. Even though we've had high case counts, our hospitalizations have been stable, and that's a testament certainly to the people working in our system and people protecting themselves as much as they could have maybe before. But we have to really just do even more through this next several weeks and months as Omnicron passes through.
Thank you both. On va maintenant procéder avec M. Jean-François Boisvert.
We will now proceed with Jean-François Boisvert with Acadie Nouvelle. Hello, my question, I believe, is for the Premier. Currently, we will be sending students home earlier for the holiday season. They have already missed a lot of school days, in some regions more than others. Have we thought about maybe doing distance learning this time, or is this not even an option?
Well, certainly it may become an option after the Christmas break, but really if we're ending this send school kids home at the end of this week, and that's really only probably 3 days of school time because they were scheduled to end next week anyway, which probably that it would be more like Wednesday or so. But ideally, it won't be a big loss of a full week, given it's the Christmas break period. And the following 2 weeks were scheduled holidays in any case. So in this particular scenario, we're allowing a 3-week window to basically give kids, to stop the transmission, to be out of the system and be directly contacting so many, changing the sporting events, so again, limiting transmission, because 50 to 60% of our cases are directly related to this activity within schools. It also gives time for us to get caught up in the vaccination levels for this age group. And although we're doing well, in this next 3 weeks, we should be able to do, I guess, a whole lot better. So when they return, we would be in better shape on the vaccination levels.
Monsieur Boisvert, as-tu suivi cet après-midi?
Do you have a follow-up? Yes, I have a follow-up for Dr. Russell. I would like to know about vaccination.
So we have the booster available for people 50 years and up. When will the other age categories be eligible for the 40 plus, the 30 plus, for them to get the booster?
Why are we not explaining?
Sending the kids home.
Oh, no, I thought it was.
Perhaps I can help with that. We certainly have every intention of increasing our opportunity for booster shots as soon as possible. Right now, it is about capacity, and so we are engaging with many different professions who have the ability to inject doses to line those up, because we would like to see an expansion of another 50,000 spaces between now and the end of the year. But we are determining now if we can make that happen in a relevant timeline, but we will most definitely be increasing capacity for the early new year to ensure that we get as many boosters in arms as soon as possible.
Merci beaucoup. Thank you, Minister. Savannah Odd with the Telegraph Journal.
Hi there, can you hear me okay?
Yes, thank you.
My question is for Dr. Russell. I'm just wondering, with the arrival of Omicron and also, I guess, in the previous weeks where we've seen a lot of cases, can you tell me about how contact tracing is happening? Is public health still directly contacting close contacts of a case? And what does a close contact mean now?
Great question, Savannah. We have been really evolving as the case numbers and case counts have been increasing, but also now with the arrival of Omicron. That variant, again, as I mentioned, transmits so quickly that it is almost impossible to keep up with the contact tracing. So right now, we're trying to pivot and adapt with that, as other jurisdictions are as well. And so with respect to the contact tracing right now, as we speak, we're revising how that's working, and in terms of who is a close contact and how they're contacted and who has to isolate and how long. So I actually don't have the final details on that, just to say that it is evolving quite quickly. And again, we're trying to maximize all the efficiencies possible within the system to do our best, knowing that there will be limitations in terms of what we can accomplish based on the rapid spread of Omicron.
Ms. Odd, do you have a follow-up?
Yeah, I do, thanks. And sort of on the same topic, I guess, over the weekend, part of the release had mentioned some information sheets about how to contact maybe folks that you've had close contact with if you do test positive. Can you talk about why you feel it was necessary to kind of introduce those and you know, maybe some of that instruction, what that instruction is for people in contacting those they had close contact with?
Well, again, it's the nature of the beast in terms of how things are evolving. The close contacts in terms of how numerous they are and how quickly the spread of the new variant is expected to happen. We're trying to pivot and respond to that in terms of the types of details that we need to be able to empower people to be able to help with identifying cases and making sure they're isolating at home and getting tested. We do anticipate that continuing the point of care testing, that program is really important right now for people. It is possible to still pick up those type of tests through the chambers of commerce around the province and also through the schools right now. So that's part of the strategy over the Christmas holidays, is to make sure that people have access to those. But it is still important to get PCR testing. And again, we've had a surge in demand here in Zone 3. We're responding to that demand. But the message still has to be that if you have symptoms, you need to stay home. And when you do get that confirmation PCR test result after the POTC has been done and is positive, if that's the case, you do have to follow all the instructions that are provided to you, whether they're written in the written form or whether it's a phone call, etc. It's very, very important right now.
Thank you. Marie Sutherland with CBC.
Hi, I think I've
Hello.
Hi, my question's for Dr. Russell. How would you classify the severity of the confirmed Omicron cases in New Brunswick? Asymptomatic, mild, severe?
Well, somebody asked me the condition of the current cases. At this moment in time, I don't have those details. What we know in a general sense is that because of the transmissibility, we do expect the numbers to rise very quickly, and that is a problem with respect to, the risk of hospitalizations and ICU admissions. So we're keeping a very close eye on that, but as the Premier mentioned, that is why we're acting today with respect to the new information we're providing to New Brunswickers in terms of how to protect themselves moving forward.
Ms. Sutherland, do you have a follow-up?
I do. This question's for Minister Shepherd. So when you announced the winter plan at the December 3rd COVID update, you said that grocery stores and other retailers would remain open but must enforce physical distancing or may instead require proof of vaccination. So this has since been interpreted and widely shared on social media as New Brunswick grocery stores can ban unvaccinated patrons. I'm just wondering if you can please clarify, given that grocery stores are considered essential, can grocery stores opt to ban unvaccinated would-be customers, and why was this option added to the winter plan?
We've had great conversations with our grocers and pharmacies across the province. There's no intent on their part that we can see for them to ask for those vaccinations, but they must ensure social distancing.
Thank you. Bobby Jean McKinnon with CBC.
Hello, can you hear me?
Yes, thank you, Ms. McKinnon.
Yes, thank you. Dr. Russell or Minister Shepherd, are any of the travelers isolating in New Brunswick from one of the provinces with confirmed Omicron cases? And is New Brunswick considering imposing any restrictions on people coming from those provinces?
I'll start, and Minister Shepherd can add to my comments. When we learned about the cases coming out of South Africa, Nigeria, and other African countries at the federal level, we definitely took steps and had conversations around what every province needed to do. And I forget what the date was, but we identified all travelers coming from all of those areas within a 14-day period early on, so that they were contacted directly. They were tested on, I forget what days, if it was day 5 or day 3, and then maybe day 10. And so that was happening early on. And then as people are coming into Canada from those countries, very strict measures in terms of follow-up and testing have been in place. And I'll let Minister Shepherd add to that.
And Bobby Jean, I heard the word provinces. So at this time, we don't have any restrictions from other provinces. But I think that every province will be watching how this evolves. What I can say, though, is that our airports, St. John and Fredericton, have received their point-of-care contact test kits that we are giving out to any travelers who come into the province. Moncton will have theirs tomorrow. And so any traveler that lands in New Brunswick via air is being given the opportunity to take the point-of-care test kits with them and to use them while they're here. And we do know that also in flying that they also have to do testing before getting on a plane.
Ms. McKinnon, to follow up?
Yes, thank you. I'm sorry if I missed this earlier, but we heard of the federal modeling last week. I'm just wondering, has New Brunswick done its own modeling yet? And what does it show for the coming weeks? And if it hasn't done its own modeling yet, why not?
Well, it's a bit of a complicated question in the sense that, yes, we have modeling at the federal level. We do use that information to do our own modeling. and again, I don't know how formal the modeling is. I have had verbal conversations with my epidemiologist, my team, to discuss that. And, you know, the combination of our own situation even before Omicron arrived in New Brunswick, you know, has been challenging in terms of case numbers and hospitalizations. So adding in the conversations we've had at the national level with our counterparts across the country and Public Health Agency of Canada, again, we're very concerned about this situation, Bobby Jean. So all the measures that we're announcing today, all of the information that we're providing today really is in preparation for this wave of Omicron to take over, which is what we're expecting to see in Canada. That's what the modeling shows. The modeling shows that Omicron variant will take over from Delta very soon. It's happening in other countries already. So the basis of the modeling here in New Brunswick and in the rest of Canada really is around projecting what the hospitalization and ICU admissions will look like. And the sheer volume of cases that we expect to see based on that doubling time and based on the transmissibility being 30% higher than with Delta. Again, we're very, very concerned here in the province as well as the rest of the country. And so we're all working as hard as we can right now to make sure that we're prepared and that the public understands what the risks are and they can take the steps necessary to protect themselves, their families, their communities, and our healthcare system.
Thank you.
I'm sorry, but
Andrew
do you actually have
Waugh
any
with
numbers to
Brunswick
go with
News.
that?
Andrew Waugh.
Yeah, okay. So my question is to any one of you that can answer this. So Minister Shepherd said that we're at about 9-point-something% of people eligible, New Brunswickers, who have had their third shots. Is this about what the province expected? Higher? Lower? If someone could speak to that, that'd be good.
I'll take that, Andrew. I think it's about where we expected it to be, and of course, knowing what we know now with Omicron being in the province, we know that we want to get those boosters out even faster. So that's why we're going to be making preparations to expand those clinics. But that 9.2% represents 69,863 doses.
Mr. Waugh, do you have a follow-up?
Yeah, I do. School, going K to 6, shutting that down, why not shut the rest of it down? I mean, you know, there's a lot of cases involving people 19 and under. It's not just in the K to 6 grades. Like, why wouldn't it just be better to take a collective break and say, okay, like, Premier, you spoke about trying to slow down transmission, but if it's only the K to 6 kids, does that actually do that? I mean, don't they have brothers and sisters?
Well, it does. See, this group is not eligible to be vaccinated. And so that is the biggest difference. And what we're finding in areas of transmission is really they're picking this up in school. So having them out of the school system quicker is a plus. The other groups can be vaccinated, and that's not where I guess we're not finding the same level of transmission. But that is the biggest difference. One group can be vaccinated and the younger ones can't.
Thank you. Thank you both. Thank you. We're going to go to Isabelle Legier with CBC. Isabelle Legier. Mesdames et messieurs, ladies and gentlemen, that concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.
Merci beaucoup.